Hi, this is Cindy from Essential Therapies, and we're going to talk about neutral spine position. So we often hear about core strengthening and doing things for your core, but rarely do you hear people actually define what the core is. So we're just going to take a few minutes and describe that for you. So this is a picture of the spine from an anatomy book, and when we tell people to have good posture, we don't really mean to sit up straight, we mean to sit so that your spine looks like it does in the anatomy book. So there's obviously some curves here, and what we're going to do is talk about how to find neutral spine so that your spine looks as close to the anatomy book as possible. So one of the ways we're going to do that is to feel certain bony landmarks in the pelvis. So I just want to point this out before I get into the position. So there are 3 points here, here, and then the pubic bone that make a triangle. So when we get into the position, and you'd be doing this on the floor or a table if you have one, usually a bed is too squishy to do it unless your bed is really firm. We're going to be feeling for these bony landmarks and then looking at them as a triangle on the pelvis. Okay? So Maggie's my little helper today. If you have some tightness in your neck or your chest, you may need a couple of folded hand towels, so keep those nearby. So you're going to come to your back. Oops, come here. And if your head is tilted back like this when you lie down, you're going to want to make sure you can try to straighten it out. If you can't straighten it out, then you're going to try a folded towel or two just under the back of the head. So not under the neck exactly, but just under the part of the head that touches the floor. So I'm going to take them out for now. Then you're going to feel for those bony landmarks on the pelvis, that triangle. So there's one on the right and left, and then your pubic bone. And I usually like to take my hand and actually feel it like so. And once you have a good idea where they are, you're going to tilt, Maggie, you're so funny. You're going to tilt the pelvis up and down just to get a feel for that triangle. So first of all, we're going to take the awareness of the point and bring the point down toward the floor. When you do that, you're arching the back up off of the floor. So you're making your back like a sway back. Okay, most people are familiar with that term. Something that you would see, a lot of pregnant women have a sway back problem because they have all this weight out in front, so there's too much of a curve going forward, a sway back. The other way, now we're going to take that point and tilt it up to the ceiling, and when you do that, you feel the small of the back press down into the floor. So if you were sitting in a chair and you were slouched or rounded in that low back, that's what this position would be. So just go back and forth, and some people really have a difficult time just doing this, feeling this movement in the pelvis and rocking back and forth. We call these pelvic tilts. Now, you can do this by pressing your feet into the floor and using your hips and your legs to make this movement happen. But what I want you to start thinking about is using the abdominal muscles and the back muscles, your core muscles, to do that. So you're going to use your hands to help you feel. You're going to have a hand to feel for the triangle and a hand to feel for the muscles in your abdomen. So here we're going to tilt back and forth again, get a feel for that triangle, and then get an idea for where the middle position would be, or if you were to place a board on top of those 3 points, you would want that board to be parallel to the floor. So these 3 points of the triangle should be parallel to the floor in neutral spine position. And that gives you an idea of where it is. So what I like to do is put a hand underneath the small of the back, just the palm down, just the fingertips under there, so I can get a feel for how much pressure is on my hand or how much curve is in the back as I'm tilting the pelvis. So I'm finding the neutral where the triangle is parallel to the floor, and then I'm going to take the other hand and feel, poke into my belly and see if that feels tight, see if the muscles are tightening very well. And even just poking in here gives you a little bit of facilitation for those muscles to make them work better. So here's neutral for me. I can tell if I come out of neutral, my hand will either press down more, or my back will press down more onto my hand here, or that would be if I come down too much this way and now the point of that triangle is going up. If there's less pressure on my hand, my back starts to arch and go into that sway back position, or the point of the triangle is pointing down, now I have less pressure on this hand. So this gives you an immediate feedback. It's like a biofeedback device to have your hand here, so you can feel if there's any movement going on. So you're going to find that neutral position, brace the muscles here, feel for any movement, and then just hold that position. So the first step is to feel where that pelvis is in space. The second one is to be able to hold that neutral position without doing anything and just feel the abdominal muscle tighten. From here, we will work into expanding the strength and the different movements that we do to challenge this position. So as we challenge the position of staying here, the body has to use more muscle to not move. So that will be the second portion of our talk about core strengthening in the next video. But for now, you're just thinking of where is that neutral position, finding the bony landmarks on the pelvis, getting familiar with the pelvic tilt, finding that position where that triangle is parallel to the floor, putting your hand here so you can feel how much pressure is there, and bracing or tightening in your core. Thanks.